Okay. We all just jumped off that call and we're back.
All right.
Exciting. And yeah, I'll wait a minute for John to get on. I'm not sure he's called back in yet. Oh, are you there, John?
Mm-hmm.
Oh, great.
I beat you here. That's why you didn't hear from me.
Yeah, man, you are fast. All right, let's go ahead and get started. We will call this meeting of the Coos County Board of Commissioners to order. And please rise and join me for the Pledge of Allegiance. I pledge allegiance
To the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. We are going to have to practice that one a little bit.
Well, at least you were.
We were going a lot faster.
I think we just may leave it to the people in the room.
Maybe that's what we should do. I've seen
We all
better.
have different cadences.
We do, and there's a delay too, which is the other funny part.
Oh, yeah. I hadn't thought about that.
That's a delay.
So do we have any public comments?
No, we do not.
Do we have anybody from the public there? I'm trying to get my live stream up and going so I can
Yeah,
see.
several. Besides staff, yeah, there's 2 people, 3 actually, with the television. Okay.
Okay.
You want to start with?
Well, let's go ahead.
Start with
go ahead.
3A.
Yes. Do you think it'd be easier, Bob, if you led the meeting since you're in the room?
If it's easier for you, you're the chair.
All right. You know what? Why don't you go ahead and lead the meeting since you're in the room?
Okay, 3A, request approval of resolution, addiction recovery continuum of care, local alcohol and drug planning committee. Come on up. Ross Aker and Kate Framer here.
Great.
Good morning.
So begin whenever you like.
Okay. Good morning. Thank you for
Good morning.
having us on the agenda today. And thank you for keeping it on the agenda in light of the current pandemic. In fact, this resolution is even more timely. People with substance use disorder are in the COVID-19 high-risk category. I'm Kate Frame, and I'm an independent consultant that's been working with the Coos County Local Alcohol and Drug Planning Committee for the last 18 months. And I have with me Ross Acker, who is the LADPC chair. And I've been working with LADPC to do strategic planning, to reorganize, and to better address the impact of substance misuse on Coos County. When we first began this process, it became clear that we truly didn't know the full scope of the problem because there was no mechanism in place to be able to gather data from different disciplines and aggregate it and analyze it. So this became a priority to us, and as we began to gather this information, we saw more clearly than ever the huge community and economic toll that substance misuse takes on our county and the people who live here. This isn't a justice system problem or a healthcare problem. This is a community problem that affects almost every family in our county. And when we look at statewide data, it's clear that our county is not alone in this fight. In spite of Oregon having the 4th highest substance abuse rate in the nation, according to 2017 Substance Abuse and Mental Health Administration data, our state has been slow to respond to the problem. That same data ranks Oregon as 50th in the nation for access to SUD treatment. In light of the scope of this problem, this slow response is unacceptable, and it's costing Coos County residents their lives and unjustly burdening our local systems. Addiction is a lifelong disease that requires a continuum of care that supports long-term recovery, and we need our elected officials to prioritize this. This resolution is a first step in Coos County holding our statewide elected officials accountable. The Oregon Alcohol and Drug Policy Commission has been tasked by the legislature with developing and implementing Oregon's first statewide strategic plan addressing substance misuse. The Coos County Local Alcohol and Drug Planning Committee is asking that the Coos County Commissioners review this resolution we have written, advocating for a statewide addiction recovery continuum of care, and we humbly ask that you adopt this resolution and allow Coos County to join the ranks of other Oregon counties in holding Oregon's leadership accountable.
Okay, do you all have the resolution in front of you? John and Melissa?
I have.
Yes, we do.
Do we
Do we have a resolution number on that, though?
Yeah, it's got some question marks. What's
I
it?
didn't put a number on it because I didn't know if you guys wanted to make any changes, if you wanted to approve it at all. I can number it once you're done.
Okay, perfect.
I would move that we adopt the proposed resolution.
Do I have a second?
I'll second.
Am I? Okay. I thought Melissa was still there. Anyway, all in favor of the resolutions in the matter of advocating for a statewide addiction recovery continuum of care? And we will add the resolution number 20-04- whatever we come up with as the last resolution previous to this one.
Aye.
I would make a comment before we vote, and
Okay.
I'm going to vote for it. But
For discussion?
I believe this and many other things that we are doing in this and many other things that we are doing, we're treating a symptom of a bigger problem, and that bigger problem is poverty. And until we somehow address poverty, particularly rural poverty, we will continue to have these types of problems no matter how much we throw at, how much money and other resources we throw at the problem. That's my little diatribe. I'm prepared to vote yes.
Melissa?
Thanks. I just wanted to thank Ross and Kate for their work on this, as well as, the rest of the LADPC. We really appreciate our volunteer committees. We know you don't get paid any extra for this work you do, and this is an important issue, and we appreciate you bringing it to us. Thank you.
Thank you, Melissa. I would also like to add a few comments as well. So again, my name is Ross Acker. I'm the Director of Care Coordination at Advanced Health, our CCO, that oversees 2 of our counties. I would like to add a few comments to what Kate was talking about this morning. My perspective is from a professional counselor one. I've been in this community for 10 years now. We own a home. Our children are in the public school system. I've been overseeing the management of the mentally ill during that time. And in this new role at Advanced Health and as chair, my perspective is more of a social science one. A former scientist and now clinician, and we are actually foreseeing some changes to our mental health landscape over the next couple of years. It's going to impact the community at large, and the LADPC is part of that. There are many professionals in this committee now that represent many different sectors of both counties. So this isn't just about alcohol and drug. This is also about coordination of care. It's about redistribution of resources in our community. It's about aligning with each other technologically in a way we haven't done before. The pandemic has definitely speeded up the process and how we connect, because we're doing that now online through telehealth. So telehealth is another facet of this piece that we're talking about. You will see an emergence of the telehealth system in both counties because of the pandemic. It's already starting to happen. The state is loosening rules on the procurement of this service. It's one of the issues that we're talking about now within the committee is a word called diversion. It's a word I've been bringing up for years. Diversion out of the criminal justice system and also out of the healthcare system, i.e. the emergency room. Our emergency room at Barrier Hospital is overrun with individuals who are intoxicated. Patrol is overrun with people who are intoxicated. Where do these people go? Do they go to the hospital? Do they go to the jail? There needs to be a third option. It's called a sobering center. It's one in Douglas is being looked at right now by ADAPT. There are other sobering centers in our state. There are several now. Law enforcement needs help. So does the hospital. That is why I created CIT, crisis intervention training. All of these programs I'm talking about, they're all interrelated with each other. The demand will continue. We have to figure out a better way to align with each other collectively in providing care to our members, our community partners. It's the same people that have been here for years. I've been working with the sheriff for years about this. There have been some cultural changes within the county, such as internal peer support amongst law enforcement that wasn't even talked about a few years ago. It's happening now. We have a mobile response team, counselors that are out in the field. We have alcohol and drug counselors going to the jail. These are all fairly new programs that need to be supported and expanded. I'm telling you, as a professional counselor overseeing the state mental health system, it is frozen. That's why they've created CCO structure in our state. It's a regionalization of service care that is already happening in other states. So what I'm describing to you is something that's coming here, and we're trying to adapt as best we can. And some of these issues are being talked about in the committee.
Thank you. Kate, anything else?
No, thank you for your time.
Anybody from the audience? Hearing none, all in favor?
Aye.
Aye.
Thank you very much.
Thank you, Commissioners.
Thanks, Ross.
Thank
Kate?
you.
Item 3B, request approval of contract with Columbia Care, Health and Wellness. Do we have anybody from Health and Wellness? I guess not. This contract provides traditional housing for Bay Apartments for clients, 10 units for $3,472.21 for total monthly, and the salary of one FTE case manager of $4,450 per month. Total monthly compensation for the use of 10 units and one FTE case manager of $7,922.21, not to exceed. No general funds will be used for this contract. Do I have a motion?
I move the board approve and sign contract with Columbia Care for Bay Apartments, which includes 10 units and one FTE case manager for an annual amount of $95,066.52.
Do I have a second?
I will second.
Discussion? Hearing none, all in favor?
Aye.
Aye.
Okay. 3C, request approval to purchase seed and adopt sole source findings, County Forestry.
Good morning.
Good morning.
Coos County
Morning.
Forestry would like to purchase approximately $30,000 of genetically improved Douglas fir seed to be used in conjunction with the 2020 growing contract. There's money in the reforestation budget for this purchase. I'd like you to authorize the purchase of Douglas fir seed from Roseburg Forest Products in amount not to exceed $30,000 and adopt sole source findings.
Okay, do I have a motion?
I move to
I
authorize.
move to author-
Oh, go ahead, Melissa.
Nope, go ahead, you got this.
I move to authorize purchase of Douglas fir seed from Roseburg Forest Products in an amount not to exceed $30,000 and adopt sole source findings.
Do I have a second?
Second.
Okay. Discussion? Hearing none, all in favor?
Aye.
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 Okay, thank you. For anybody else that's coming up, if you want to turn the mic at 90 degrees, it keeps it from bursting in and out and going thump all the time. Item D, request approval to purchase a utility ATV for forestry.
Okay, quotes were solicited for the purchase of a utility ATV. 2 quotes were received, with Highway 101 Can-Am submitting the low quote of $13,250. Requested action, please accept the low quote from Highway 101 Can-Am in amount of $13,250 and authorize purchase of utility ATV.
Do I have a motion?
I move to accept the low quote from Highway 101 Can-Am in the amount of $13,250 and authorize purchase of a utility ATV for the Forestry Department.
Do I have a second?
Second.
Discussion? Hearing none, all in favor? Aye?
Aye.
Aye.
Okay, thank you. 3E, request approval of resolution to transfer funds, forestry.
Board of Commissioners approved solicitation of quotes for the purchase of an ATV at work group meeting on 3/24/20. Therefore, a resolution has been prepared and attached for the transfer of funds from reforestation to the equipment line item to pay for the purchase. I ask you to approve and sign the resolution 20-03-051B, transferring appropriations from reforestation to equipment in the county forest fund.
Do I have a motion?
I move we approve and sign Resolution 20-03-051B, transferring appropriations from reforestation to equipment in the county forest fund.
Do I have a second?
I'll second.
Discussion? Hearing none, all in favor? Aye?
Aye.
Aye.
Okay.
Thank you.
3F, request approval of contract with PBS Engineering for a fish pit quarry site assessment. Road Department, John Rowe, that is.
Good morning.
Good morning.
Morning, John.
Morning.
Yeah, we'd like to approve an agreement, a procurement agreement with PBS to do additional site assessment, environmental assessment at Fish Pit as part of our work to give it back to ODOT, this property. So pretty much doing our due diligence for $27,625, and those costs are set by their current contract with Multnomah County.
Okay, do we have a motion on this?
I move we approve and sign a contract with TBS for fish pit site assessment services not to exceed $27,625.
Do I have a second?
I will second. Second.
Discussion? Hearing none, all in favor? Aye?
Aye.
Aye.
Okay. 3G, request approval of contract with SAFE Project. Community Corrections. Kelly,
Hello.
good morning.
This is approval of the.
You have to get closer for them to hear
Okay.
you.
This is approval of a contract between SAFE Project for the victim services. This is a justice reinvestment grant that gives nonprofit victims certain amounts of money that was approved by our lip sync and our Board of Commissioners. And so we are requesting approval so that we can go ahead of the contract so we can pay them out the money from the grant of $10,296.
Okay, do I have a motion?
I move we approve the contract between Safe Project Community-Based Victim Services with Coos County in the amount of $10,296.
Do you have a second?
Second.
Discussion? Hearing none, all in favor? Aye?
Aye.
Aye.
Okay. 3H, request approval of contract with Kids Hope Center. Kelly?
This is again part of the same justice reinvestment grant. And this is approval of a contract for Kids Hope Center based on victim services with Coos County in the amount of $30,891.
Okay, do I have a motion?
I move approval of the contract between Kids Hope Center Community-Based Victim Services with Coos County in the amount of $30,891.
Do I have a second?
Second. I'll second.
Okay, discussion. Hearing none, all in favor? Aye?
Aye.
Aye.
Okay.
Thank you.
3I, request approval of PERS retirees policy. Caroline?
Good morning.
Morning.
Good morning.
Morning.
So this is the policy that HR put together to address how to handle PERS retirees coming back under the new system that took effect January 1st. This is basically the same policy that was put before the Board of Commissioners previously, and just ultimately allows the Board of Commissioners to be the ultimate decision maker on the contractual terms for hiring a PERS retiree back under the new rules.
Okay, do we have a motion?
I move to approve the Coos County Employment of PERS Retirees Policy effective January 1st, 2020.
May I have a second?
Second. Second.
Discussion, any discussion?
I'll just say that I when this was last on, I pulled it because I wanted to look at some issues. I left it the same as it was before. If we hire someone back for 6 months and that person is a union employee, if they're going to be rehired, that may require reaching out to the union and trying to work out whether they're going to be agreeable to that or not. So for union people, it might be that 6 months is all she wrote as far as the rehire is concerned.
Alrighty.
But that's just something we'll deal with if it comes up.
Okay. Did you hear that? John and Melissa?
Yes.
Yes?
Okay.
Yep.
Any other discussion? All in favor?
Aye.
Aye.
Okay, need a motion for the consent calendar?
Move approval of the
Move
consent
to-
calendar.
I'll second.
Okay, all in favor?
Aye.
Okay, we have no late agenda items. Commissioner reports. Who wants to go first, John or Melissa?
Melissa, your turn.
There's always plenty to report, but I, like my fellow commissioners, we've been meeting right now 3 days a week in order to try to stay ahead of all the questions that have come at us about the coronavirus. In addition to that, I have been attending the EOC meetings every morning for Coos Health and Wellness, as well as a meeting last Friday where a decision was made to form a joint incident command structure with the hospital and the other medical providers in the area. I was informed yesterday that the co-incident commanders on that are Florence Portal-Stevens, Brian Moore from the hospital, and John Winters from North Bend Medical Center. And so Coos Health and Wellness is still working really hard on this issue. We had a conference call with Representative DeFazio yesterday. I have been on conference calls with Representative Walden and Senator Merkley, just dealing with them with the constantly changing climate that we're all facing related to the coronavirus. Let's see, trying to think. Association of Oregon Counties has also been meeting by phone. The executive committee has been. It looks like we will be having a legislative committee meeting by phone next Monday in order to talk about some of the proposals that are being put out by the legislature to deal with the coronavirus issue. I've seen some good news today being put out that it looks like we're about 2 weeks away from the apex of the curve, and thanks to the social distancing that Oregonians are doing, the apex of the curve is projected to be lower than was originally discussed. So, that's some preliminary, hopefully good news. And I think that's all I've got, except, we're still scheduled to start budget next Monday.
Okay, John?
I really have nothing to add to what Melissa said. Our agendas have been pretty much dominated by the coronavirus. I do want to express pride in our public health group for the leadership they've exhibited in handling the crisis. That's all I have.
Okay. For me, being on the phone yesterday with Congressman DeFazio, I brought up our failing 911 system. He said we'd have staff look into getting funding from FEMA. So I need to keep on top of that, and every few days ask them what kind of progress they've been making. Hopefully we won't have, it'll be on the ballot, but if it gets funded, we won't have to enact the the temporary tax for that. There is a movement for STEP programs, interested other parties from Florence to Brookings on catchable salmonids, salmon, trout, steelhead, etc. It's called the Oregon Anglers Alliance. I was elected to one of the positions of board of directors. It is to have a stronger voice representing all of these groups in Salem with the Fish and Wildlife Commission to have more catchable fish on the south coast of Oregon. We've had several meetings, and surprisingly enough, thousands of dollars are already being contributed by private individuals for this particular project. Yesterday, I had a extreme concern. I was listening to the Rob Taylor show from 3 to 5 yesterday. They had 2 of the candidates for county commissioner on, which was great. But he said something that really got my attention and really bothered me. I mean, really bothered me, was that somehow the county commissioners were limiting the people's Second Amendment rights. That is so far from the truth. It is irritating, to say the least. With that, thank you all. We are adjourned.
So John and Melissa, do I have permission to use your stamp on these documents that you approve?
Yes, ma'am. Yes,
Yeah,
ma'am.
can you
Go
hear me
ahead.
still?
Thank you. No,
Did you
we can't hear you.
Yes. Okay, good. Yes, you do, Bob. I started to